Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Rhinoplasty. Introduction. Rhinoplasty is a surgical procedure that can change the size, shape, and contour of the nose. It can also narrow the nostrils and define the tip of the nose. Rhinoplasty can repair nose defects that are caused by an injury. It is also used to correct birth defects or improve some breathing problems. This program will explain the benefits and risks of rhinoplasty. It includes information about rhinoplasty, why it's done, who can benefit from rhinoplasty, and the risks associated with the procedure. Rhinoplasty. The nose is a three-sided pyramid. It is made of bones and cartilage which give the nose its shape. This framework is covered with skin. Rhinoplasty is surgery for the nose. It is sometimes referred to as a nose job. Rhinoplasty can affect the nose's bone, cartilage, or both. It can be used to correct or reconstruct the form of the nose. It can also be used to restore function to the nose. There are two types of rhinoplasty, cosmetic and functional. Cosmetic rhinoplasty is nose surgery that is done to improve the appearance of the nose. A person may choose this type of surgery to feel better about his or her appearance. Cosmetic rhinoplasty is used to adjust the angle between the nose and upper lip, decrease or add to the size of the nose, reshape the tip of the nose, straighten the bridge of the nose. Functional rhinoplasty is nose surgery to repair the nasal valves. The nasal valves are the nostrils on the inside of the nose. A person may choose to have this type of surgery to improve their physical health. Functional rhinoplasty is commonly used to correct a birth defect, improve breathing problems, repair defects that result from an injury. Even tiny changes to the structure of the nose can make a big difference in how it looks. Often, only a single procedure is needed to get the desired result.
If a patient is not happy with how the first rhinoplasty procedure went, they will have to wait another year for a follow-up procedure. This is because the nose can change over the course of the year.
How to prepare. If your surgeon recommends rhinoplasty, the decision whether or not to have the procedure is yours. You should have realistic expectations about what rhinoplasty can do for you. You should also understand the possible risks and complications, as well as the cost of the surgery. Your surgeon will ask you about your medical history and current health. Certain lab tests may also be done.
During your meeting, photographs will be taken from different angles. These images let you and your surgeon review what your nose looked like before and after the surgery. They can also be used as a reference for your surgeon during surgery. You should not have rhinoplasty if you smoke. Smoking can prolong the healing process. If you smoke, you will need to quit smoking. You will have to wait a while after quitting before you can have rhinoplasty.
Your surgeon will give you more specific instructions on how to prepare for your surgery. Instructions may include what and when to eat or drink and which medications to take. Tell your surgeon about any medications you are currently taking before surgery. Some medications may need to be stopped or changed, such as aspirin, anti-inflammatory drugs, and herbal supplements. These medications can increase bleeding during and after surgery. You should also ask your surgeon about what to expect after surgery and the plan for follow-up care.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
During the procedure. Rhinoplasty may be done under local or general anesthesia. This procedure usually takes about an hour. Local anesthesia is limited to a certain area of the body. You will receive an injection of numbing medication and you will be awake during the surgery, but you will not feel any pain during the procedure.
If you receive general anesthesia, you will breathe it in or have it administered with an IV line. General anesthesia puts you to sleep during the surgery and blocks the sense of pain in the whole body. Rhinoplasty is often done from the inside of the nose, so there is no incision line or scar. The surgeon uses tools inside the nose to change the shape of the bone and cartilage.
Usually, the surgeon makes cuts inside the nostrils. Sometimes the surgeon makes cuts in the septum, which is between the nostrils. Next, the surgeon separates the skin from the underlying bone or cartilage. The surgeon then cuts, trims, or builds up the nasal bone or cartilage.
The surgeon may take cartilage from inside your nose or ear, or they may use an implant or bone graft.
Bone grafting is a procedure in which bone material, known as the graft, is placed in or near another bone. The graft enhances the bone that it is inserted into.
The surgeon will place a nasal pack inside of the nose. This is to reduce bleeding and stabilize the repaired tissues. The nasal pack could contain wads of cotton, gauze strips, or other materials. It often stays in place for 1 to 5 days.
Some nasal packs are absorbable. They dissolve over time. Others require a return visit to a healthcare provider so that the nasal packs can be removed. Risks and complications. Rhinoplasty is a safe procedure, but there are several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help detect complications early. The risks and complications are those related to anesthesia and to any type of surgery. Risks of general anesthesia include nausea, vomiting, urine retention, cut lips, chipped teeth, sore throat, headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you. They will ask if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg. They may go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. Let your healthcare providers know right away if any of these symptoms happen. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots. Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. 2. Bleeding, either during or after the operation. This may rarely require a blood transfusion or another operation. 3. Skin scar. Other risks and complications are related specifically to this surgery. These are very rare, but it is important to know about them.
The risks associated with rhinoplasty include a scar or uneven appearance, numbness, pain, swelling, or change in color that lasts beyond the recovery period, recurring nosebleeds, trouble breathing through the nose.
After surgery,
you will need to elevate your head higher than heart level while you rest to prevent too much swelling and bleeding. You may have a stuffy nose after the procedure because of swelling. Keep the splint or cast on your nose for a week to support and protect it as you heal. You may have a little blood and mucus coming from the nose for a few days, and when the dressing is taken off, you will have gauze, called a drip pad, under the nose to catch the drainage. Change the gauze as instructed. Eat foods that don't require a lot of chewing And limit facial expressions to prevent bleeding and swelling. Avoid blowing your nose. Brush your teeth gently and try not to move your upper lip. Don't do anything physically demanding, like running after the procedure. Don't swim. Wear button-down shirts so you don't have to pull them over your head.
The amount of time needed for the nose to heal is different for everybody. Typically, after about 7 weeks, you can return to your normal activities. Talk to your healthcare provider about the amount of time you will need to heal.
Your healthcare provider may also recommend that you not wear glasses or sunglasses for the first 4 or more weeks. If you need to wear glasses, tape them to your forehead so they don't rest on your nose. You could also try cheek rests. Avoid exposing your skin to the sun for 2 to 3 months after rhinoplasty. This can change the color of your skin permanently. You may have swollen, numb, or discolored eyelids for 2 to 3 weeks after surgery. In rare cases, it can last up to 6 months. A small amount of swelling may happen for up to a year after the surgery.
Some people benefit from using ice packs or a cold compress. These items can reduce swelling and discoloration around the eyes. The nose takes a long time to heal. You may not see the final results of your surgery for up to a year. If you are not happy with your results, you will need to wait at least 1 year before having another procedure.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Rhinoplasty is a surgical procedure that can change the size, shape, and contour of the nose. It can also narrow the nostrils and define the tip of the nose. Cosmetic rhinoplasty is nose surgery that is done to improve the appearance of the nose. A person may choose this type of surgery to feel better about his or her appearance. Functional rhinoplasty can repair nose defects that are caused by an injury. It is also used to correct birth defects or improve some breathing problems. Rhinoplasty is a safe procedure, but there are several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help detect complications early. The amount of time needed for the nose to heal is different for everybody. Typically, after about 7 weeks, you can return to your normal activities. Talk to your healthcare provider about the amount of time you will need to heal.
Thank you for using Explain.